There are a lot of products in development for the treatment of HCC, and they range in nature from targeted therapies to broader therapies such as immune checkpoint inhibitors. I would like to first have a disclaimer that it would be impossible to cover all of them, so I will highlight some examples. There's a couple of compounds that target an important receptor as well as ligand in hepatocellular carcinoma, which is MET, or hepatocyte growth factor, that axis, which is active in this disease and has been associated with prognosis and outcome. These include tivantinib, which is being evaluated in comparison to placebo after sorafenib failure or progression. Again, this targets MET. Another compound in this space is known as cabozantinib, which targets both the VEGF receptor 2 as well as MET, and is being compared to placebo as well in this space after sorafenib failure. Another area that is being primed for drug development is targeting alterations in the FGF pathway, the fibroblast growth factor pathway in hepatocellular carcinoma, especially the FGF19 ligand. And there are several compounds going into clinical trials targeting that pathway. Targeting tumor-initiating cells, or what's also known as cancer stem cells, by targeting the Wnt pathway is another area of drug development for hepatocellular carcinoma. And lastly, the immune checkpoint inhibitors, which have gained momentum in multiple tumor types, have now made inroads in hepatocellular carcinoma. For example, at this meeting, the results of both the dose escalation phase as well as the dose expansion phase, these are interim results of nivolumab, which is an inhibitor of the checkpoint PD-1, were reported.